So we are comparing the Ipratropium versus the tiotropium. So let's compare. So firstly, we are dealing with only the Ipratropium. So we'll completely see the Ipratropium. So major points is that Ipratropium, it is the duration of action, it is short when compared to the other. So it is short. Now what about the frequency? The frequency of administration, it is about 3 to 4 times a day. The frequency is about 3 to 4 times a day. And what about the anti-muscarinic action? So anti-muscarinic action. So if you see this anti-muscarinic action, it is nothing but it is NS, that is, it is a non-selective. Then when you look at the paradoxical bronchoconstriction, so the paradoxical bronchoconstriction. So the paradoxical bronchoconstriction, it is present. And now when we move on to the tiotropium, so this was totally about the Ipratropium. Now we are looking at comparing it to the tiotropium. So the tiotropium, if you see the duration of action, it is long. Whereas in case of Ipratropium, it was short, here it is long. Now when we look at the frequency of administration, the tiotropium, it is once a day. And in case of Ipratropium, it was 3 to 4 times, whereas here it is once a day. Next, when we look at the anti-muscarinic action. So AMA, that is anti-muscarinic action, it is non-selective in case of Ipratropium. In case of tiotropium, it is relative. It is relatively selective. So it is relatively selective for what? For the M1 and the M3 receptors. To the M1 and the M3 receptors. And when we look at the paradoxical bronchoconstriction. Paradoxical bronchoconstriction. So the tiotropium is nothing but it is absent, whereas in case of Ipratropium, it was present. So this was about comparing the Ipratropium to the tiotropium. So to learn and grow daily like this, please do subscribe.